What does follow-up for continued trust building and sustainability look like? So this is the internal and external process. Trust building and sustainability is a crucial part in any community engagement effort aimed towards uplifting the many voices of a particular community. In this section, we will explore what follow-up looks like as it relates to continued trust building and sustainability with young people. A. First, health departments and community-based organizations will need to acknowledge and accept that gaining the trust of any new partner, including youth and young adults, will not happen overnight. Being patient, flexible, and realistic in expectation and staying committed to the work will have a long-lasting impact on future engagement. Health departments and community-based organizations have to be willing to be advocates for young people, even when young people are not present in the room to advocate for themselves. B, sustainability. Health departments and organizations must fully commit to engaging young people and should not cease all engagement activities even when funding ends. In the terms of sustainability, using in epidemiology to help collect targeted data and information while you are engaging young people will be useful when engaging other funding opportunities to continue the work. Engaging young people is something that we should always do and always should be added to the framework of our work. Youth advisory boards. If your health department and or organization decides to build a formal advisory board, then make every effort to continue to work with these established boards and expand participation if possible. Continue to include young people in the conversation and provide incentives and opportunities to help keep them engaged with your health department. Procurement. Health departments and organizations should continue to work with their finance and procurement team and try to procure programs and or agencies who are able to implement youth evidence-based intervention that addresses global risk factors for engaging in risky health behaviors. Consider designing a catch-all program that includes the elements of HIV prevention, treatment, linkage, substance use, social determinants of health, mental health support, and academic enrichment. These all-in-one programs can address several needs at the same time and reduce the risk of stigma and discrimination. Perhaps a solution may come in the form of a brick and mortar youth engagement center or a space youth can access all their needs in one single location. Relationships. Please continue cultivating relationships with grassroots organizations, schools, agencies, and other youth serving entities. Health departments should know who the key players are in their areas. If new services or procurement opportunities become available, you are already have a network of providers to share information with or bring onto new initiatives. This can change the way a health department and organization is perceived in your community and help build mutual trust long term. Training. To help promote technical assistance and capacity building, health departments and community-based organizations should follow up with their staff on the trainings received during the internal process. Ask folks how they have used their skills obtained during these trainings in their work and engagement with youth and young adults. This will help to tailor future trainings that both build on current skills and meet the needs of the workforce and the community. Feedback. Lastly, it's important for health departments and community-based organizations to have a mechanism in place for youth and young adults to provide feedback on an ongoing basis. Creating a feedback culture can be informal, formal, or even a blend of both. In addition, information gathered during the internal engagement process or external engagement process should be streamlined in a way that allows young people to see how their input and participation have been used in your EHE planning. Health departments must value the mindset of young people and create a safe environment for receiving feedback. Last, set clear expectations around feedback and the goals for feedback. As we wrap up, let's discuss the reasons why investing in community engagement with young people is important to ending the HIV epidemic. Investing in community engagement with young people can help to inform service models and produce relevant program needs. It also helps to improve how, where, and when services are delivered to get real-time knowledge about conditions and needs of young people directly from young people, to help maximize resources and reduce saturating the same services in the same communities, to help advance health equity and justice, especially for those disproportionately impacted by the HIV epidemic, develop and sustain relationship with current and new partners, which is always a good thing, And lastly, invested in community engagement with young people help to honor the lived experiences of young people impacted by the epidemic. So let's get into some real examples of how health departments and organizations are engaging youth and young adults. First one, youth podcasts, which helps to incorporate the storytelling framework, which allows young people to express themselves creatively and bravely. A few health departments and organizations have established youth-led networks and organizations for youth and young adults living with HIV. Some real examples of how health departments and community-based organizations are engaging youth and young adults are youth podcasts, which incorporates the storytelling framework and allows young people to express themselves creatively and bravely. A few health departments and organizations have established youth-led networks and organizations for youth and young adults living with HIV. Act 220 is a youth-led social action initiative to inspire a new wave of activism in the HIV response, which is currently active in 12 countries. South Africa co-developed and implemented various youth-targeted programs founded in evidence-based practices. A few of these evidence-based practices includes curriculums from Zazie Know Your Strength, Grassroots Soccer, and One Man Can campaign. Colorado developed and implemented a youth advisor board in which young people are hired on a part-time basis to actively contribute to the development, implementation, and evaluation of programs and policies affecting adolescents and young adults across the state. It is a great time for health departments and community-based organizations to be creative and innovative in their approaches to engaging young people, including young adults, in the AHA planning process. Thank you for tuning in. I hope these learning modules were helpful and provided useful and realistic guidance to ending the HIV epidemic in your area.